Doctors say fibroids affect 60 to 80% of women in the U.S. While some experience little to no side effects, others suffer debilitating lifestyle changes, often in silence. In tonight's special report, I take a look at how this common condition is now being taken more seriously and how treatment options have changed.
Hi. Aw, good to see you.
It has only been a few months since Dr. Kayla Nixon Marshall put an end to Michelle O'Neill's 30-year battle with fibroids.
And how have you been feeling since
Great.
the summer?
I've been feeling great.
This 55-year-old Chicago woman pretty happy with how the surgery went.
It was times I couldn't cook for myself. I couldn't make it to the bathroom. I couldn't walk. So I was immobile. I was in the bed. And it had got to the point that it got so bad. And I feel that I wouldn't be here if my daughter wouldn't have stepped forward and gave me that strength to come out.
Michelle says she's now back to walking outside, exercising at the gym, and planning vacations. She is also spending less time at a hospital, which is where Michelle says she was when her daughter first told her about Dr. Nixon.
I was in an emergency because I had to have a blood transfusion. And that's the other part of where that my fibroids took me to after all of those years. So I was getting a blood transfusion, and she called. She said, I got some wonderful news.
Michelle says she made a lot of trips to the hospital last winter because she was anemic because of her fibroids. In some women, doctors say fibroids can cause heavy bleeding, which can lead to not having enough healthy red blood cells. Since she was caring for her at home, Michelle says her daughter saw just how much she was dealing with and began to look for some real help.
Because I was just gonna, deal with it, like so many of us do.
Like Michelle's mom and aunties all did for years.
We all just dealt with it like it was something that we had to deal with, like a disease or anything, and that's just it. And as of now, I look back on all of that suffering that I went through and my aunties and family went through. They could have been free too.
Fibroids have higher incidence in women of color, and that tends to be predominantly Black or African American women, as well as some Latina women as well. But up to 80% of women of African descent may experience fibroids, and they tend to have more early presentation, so sometimes younger, and more advanced growth of fibroids as well.
Unlike previous generations in their family, Michelle says she and her daughter began to talk about how to treat her fibroids.
So it was kind of a hush thing. So it was more than just go through it. And then when your time comes, when it's over, you get back up out of the bed and you go about your day. So it wasn't talked about. So I shunned away from all education on it or even pursuing because I just thought that was something, once again, that I had to live with.
I want women, particularly who are suffering from fibroids, to know that there are doctors out there who want to listen to you and want to hear your story and want to work with you to find a treatment option that's really the right choice for you.
Michelle says she was surprised at how much time Dr. Marshall took to listen to her and find out about her symptoms. Over the years, she says other doctors told her her fibroids were benign and to take over-the-counter pain medication.
I usually think of a fibroid as 5 centimeters or more as becoming large, but of course in a patient that has multiple, even smaller fibroids, they can still have significant symptoms from those as well. So I usually think once patients are getting larger fibroids or if they're having significantly heavy bleeding leading to anemia, that some intervention is warranted.
For years, a hysterectomy was the primary choice for doctors when it came to treating a patient's fibroids.
Now there are a lot more uterine preserving options, non-surgical options as well, medication options, and minimally invasive options. I think the growth in particularly robotic surgery, the growth of minimally invasive gynecologic surgery as a specialty, which really focuses on complex, benign gynecology, really expands the access for minimally invasive procedures to patients. And minimally invasive routes have much lower complications.
Dr. Marshall performed a robotic hysterectomy on Michelle, which is not as invasive as a typical hysterectomy. She adds Michelle went home that same day and didn't require much pain medication.
I think recently we've seen patients advocating for themselves a lot more, doing a lot more research online, coming across other experiences with fibroids and recognizing that their abnormal symptoms are not something that should be brushed off. So patients are really taking ownership over their symptoms and presenting more commonly to physicians looking for options.
And that is something Michelle says she's glad she did for herself.
I am so excited for life. I have a new life. I have so much freedom.
Dr. Nixon Marshall adds that not all fibroids need to be removed. She said some patients with small fibroids that are not causing symptoms should be left untreated.